This is our warning. Premier Ford, listen.
Healthcare Union Presidents Charlene Stewart and Michael Hurley listed their demands.
Deliver full-time jobs with permanent wage increases, with mental health support, provide higher staffing levels and safer working conditions.
They need paid sick time if they contract COVID-19 and paid mental health supports to help them deal with the stress and trauma. They must be fully vaccinated.
In advance of Nursing Week 2021, the unions released polling data detailing exhaustion, stress, and even workplace violence.
65% have experienced physical assault while at work. 25% of the RPNs have experienced sexual assault while at work. 10% of RPNs have experienced stalking.
We cope barely some days by leaning on each other. Barely.
Pam Parks is a 33 registered practical nurse. She describes what it's like to pull into the parking lot at work every day.
I sit for a few minutes, collect my thoughts. Then I get out, put one foot in front of the other, and I pray and hope that today will be better.
Tanya Rahim Jutla is a 25-year RPN who says patient care has plummeted.
They decided to increase my workload and keep me so busy I have little to no time to speak up and fight for myself and my patients.
These nurses work in hospitals with the fewest staff and beds to population of any province in Canada or any country with a developed economy in the world.
The survey shows that 29% of Ontario nurses are considering leaving the profession.
The Premier has said, and I quote him, if it was up to me, I would give these nurses the bank. It is up to him. He's the Premier.
The unions are calling for the $4 temporary wage increase to be made permanent.
Stop giving me crumbs and keeping me in survival mode. Permanently give me proper pay to finally live.
Now, according to the polling data, the biggest source for excessive workload is a lack of staff. Ontario's healthcare staffing crisis does predate the pandemic, but as you saw in the polling data, it's only getting worse. 83% of respondents to the survey say a pay increase would keep them in the profession.